Hi, I'm Dr. Patrick McGrath. I'm the Chief Clinical Officer for NOCD. I wanted to talk a little bit today about obsessions and compulsions and how they're really grouped together into the subtypes and themes that we often hear about. Now, we don't officially diagnose someone as a subtype. We diagnose obsessive compulsive disorder. But the subtypes can really be helpful when we're looking at how OCD symptoms actually show up in individuals who are unfortunately experiencing OCD. Now, these subtypes can generally be placed into several different categories. One of them is harm, where people are afraid that they might do something harmful to themselves or to other people. There's contamination, which can be a physical contamination where I might get a germ or I might pass something on to someone. It can also be an emotional contamination where maybe we feel like someone who has characteristics we're not fond of has touched something. We won't want to touch it because we don't want to pick up their characteristics from that thing. There can be the just right theme where people want things in a certain order or place. And then there's also topics that are more on a taboo side. And this could be anything from what if I were to harm a child, or if I'm a newborn parent, what if I were to harm my baby? It could also take on other sexual kind of themes. It could take on sexual orientation. It could even take on religion, which we call scrupulosity, morals, or ethics. And these themes can be sometimes harder for people to discuss because of the nature of these topics just feels kind of icky to people, if I can put it that way. And they may not often know that that's also a part of obsessive compulsive disorder, because most people think of it as contamination or putting things in a certain order, and they don't think of these other taboo themes being something part of OCD. Now, for many people who have OCD, recognizing how their OCD is experienced can really be comforting, because they can start to understand that A, they have OCD, and B, that there's other people out there like them. They are not alone in this. Many people think they're the only person who has this, and that just simply isn't true. And C, it could really help with treatment. And one of the good things then about this for treatment is we have treatments for all of these subtypes, and it's called exposure and response prevention therapy. There's really not a specific treatment for a specific subtype. There's versions of exposure and response prevention therapy for all of the subtypes that we work on. Now, if you're thinking about subtypes and you can't quite understand how maybe your subtype would fall into the ones that I've said, don't worry. That doesn't mean that you don't have OCD. Everybody experiences this in a unique way. And many people have symptoms that either don't fit into one of the specific categories, maybe they fit into several, or they may not be fully aware of all of the obsessions that they're experiencing or all the ways that they're doing compulsions, because compulsions aren't just physically done, they're also mentally done. And a lot of people aren't familiar with that. So here's the thing. No matter what your subtype is, know this: help is available. And if you are looking for that help, you can go to NOCD.com. That's NOCD.com. We have our care team available waiting to chat with you to see if we can get you set up with a therapist who's licensed in your state or area, who can diagnose and treat obsessive compulsive disorder with evidence-based treatments. We hope to hear from you soon.